This is a copy of the insurance cards. We have Humana and Anthem. Let's look at the Humana card. The front part of the Humana card has the patient's name, employer, and then it also has a list of the services and how much the copay is. The back of the insurance card has phone numbers and contact information for the insurance card company in case there is a problem or you have to call for pre-authorization for services. Anthem. Even though the card looks a little bit different, it's still primarily the same information. It has the patient's name. It also has a breakdown of outpatient services, medical office services, prescriptions, and the amount of the copay. On the back of the Anthem card, once again, it has contact information for the insurance company. It's always best to go on their website, though. Page 8, Copayment and Deductibles. To assess the patient's copay or deductible, you want to make sure that you go on to the insurance company's website and do that at every single visit. Once the dollar amount is identified, take the payment from the patient and note it on the encounter form. And all of that is done at check-in. Each office has a list of the insurance companies and their websites. Very important to make sure you verify the patient's insurance coverage before the patient is seen by the physician. Some insurance companies require pre-authorization for services of certain procedures. Most cards provide the information on the back of the insurance card. If pre-authorization is required for the services and your office fails to get the pre-authorization, you can pretty much guarantee your doctor is not going to get paid. SOAP note, which is also called a progress note. It's generally a blank sheet of paper with the letters SOAP, and we will cover that in detail in the medical office clinical class. This is a medication list. It has a slot for the date, medication, and the dosage. It's a pretty general form. Physicians like to have an updated medication list at each visit. This is the encounter form, or super bill. Each medical office designs their own form, so your office encounter form will look a little bit different from this. On this particular form, the top part has the procedure codes, the bottom part has the diagnosis codes, and we'll get into that in the medical billing course. Medical records filing systems. For this practice, the patient's name is going to be Candy Apple, and the chart number is 2513. Numerical. We begin with the last 2 digits in the medical record number, which is 13. And it's often generated by the computer. Sections in the medical record department are as follows. The sections begin with 00. The next section is 01. The next section is 02. And you keep going all the way up until you get to 99. Once you have found the 13 section, then we focus on the top 2 digits. Once again, it starts with 0. We want to find the 25th chart in the 13 section. Once you have found 2513 charts, then we focus on the alphabet. And of course, the alphabet begins with A. The last name is Apple, so you have AA, AE, go all the way up until you get to AP, and then of course you find Apple. Once you have all of the apples, the first name begins again with A. A, B, C, we're looking for candy. And of course, if you can use a dictionary, once you get into the medical record department, take a few minutes, observe, pull some charts, and you will see how simple it is. This is just a quick review. Medical records. SOAP stands for what? And you can give a brief synopsis. And this is for later. It's not a big deal right now. Number 2, correct the following terms. This is just to test your knowledge. Number 3, what is alphabetical medical record system? Number 4, what is the numerical medical records filing system? And number 5, please indicate all of the important information that goes into the medical record. Check-out reception. The patient has checked in, has seen the physician, and now is leaving the office. Once the patient has been seen, he or she will come up to the checkout counter, and they will either bring the medical record with them or the encounter form. It doesn't make a difference. You just want to follow these steps. The patient will hand you the medical record along with the encounter form. Review the encounter form. You want to see what procedures were performed. The doctor should check all the procedures they performed. Your job is to add the charges together. And there is a fee list at your desk. Make sure the patient has reached the deductible and doesn't owe anything extra from the day's visit. If the patient only had to pay a copay at check-in, the patient's already paid it, you don't collect any other monies. Self-pay patients will have prepaid for services at check-in. and that will be listed on the encounter form. You want to document the payment and make the next follow-up appointment. Provide the patient with a card indicating the next appointment date. If you are making the patient a referral appointment for another facility, please document the patient's appointment information in the patient's medical record. Most patients lose the paperwork, and they will definitely call your office back, and you want to make sure you're able to have the information for the patient. Remove the encounter form, which will be sent to the billing department to be processed. Based on your office protocol, the medical record will be sent back to the medical records department or to another department.